It leads absolutely brilliantly into the next presentation from Richard Heron, who is Vice President of Health for BP. Because one of the things that I found when I moved into the civil service and had to take a much broader view of the things that were part of government policy, not just the health service, is sometimes in the health service we are a bit precious. We believe that our challenges and the things you have to do as effective leaders are particular in nature and special and somehow different from the world out there in these non-health places. Actually, most of the messages are ubiquitous, and many other industries have been better at taking them on and delivering improved outcomes for their customers or for the people they serve than the health service. So it's a delight to introduce Richard Heron.
Well, thank you. It's a real honour and a pleasure to address you today and to be invited by the faculty. I'm going to share some lessons I've learned over the past 15 years, advising in major multinational companies, not all in BP, I hasten to add, about the organisational benefits of health and well-being. And in many ways, I do feel I'm preaching to the choir. I'm also conscious I'm standing between you and your lunch, so I'm going to start with my conclusions and then build on them. I'll share with you the assertion that attending to the health and well-being of the workforce really is a prerequisite to achieving business and organisation goals that you've just heard. Employee retention, retaining people, aligning organisations, their values and their perceptions of safety are all affected by these things. I'm also minded to feel that in our organisation, we're encouraged to benchmark with other oil and gas companies. And I found it so much more beneficial to go outside the peer group. When we're looking at risks for travel, health management, for example, look at foreign office, look at telecoms companies who also go to remote locations, look at the military. Don't just look at your peer group. And I've learned so much more by doing that. So I show you BP at a glance just really to say one point. It's a complex organisation. It's made up of many different cultures, people speaking different languages, some who are difficult to reach, people with varying priorities, varying pressures, some organisational and some personal. Does that sound familiar? It's also an organisation where most people come to work with the idea they want to do a good job, they want to please their boss, they enjoy completing something that day, and they enjoy more being recognised for doing it. So, my two assertions are, first of all, good health is good for people, it's good for business, and it's also good for national prosperity. Especially as we have an ageing workforce, if we can actually influence health earlier in life, it's going to affect our NHS budgets. And good work is good for health. I'm not going to cite lots of evidence, but please do read Marmot's review, Fair Society, Healthy Lives. And I would also just urge you to revisit the WHO definition of health, because I think, along with a number of others, that it's outdated. Trying to seek a complete sense of physical, mental and social well-being is an outdated idea. I don't know how many of you in the room feel that you are in that place of complete physical, mental and social well-being. But if that's what we're seeking to achieve in what we do in the health service, what we're doing in organisations, we're set up to fail, rather than to help people achieve, stay in, and maintain their place in good jobs. So those are the assertions, and then here are my three key takeaways. The first one is think about people, places, processes, and performance. Oh, that does sound really dry, but this is actually the management system. And as has been mentioned this morning, this is actually the organisational management system, not the clinical management system, not the medical management system. And it's working out where you fit into that management system. It's our management system, not theirs, not yours and theirs, us and them. It's actually, how do we fit into that management system? When I left the NHS as a registrar in clinical medicine, I certainly felt like I'd gone to the dark side. I'm now with an oil company. I really do feel I'm sort of in the dark side. Tobacco's a little bit further down, and perhaps politics, but to survive as a physician and leader in medicine in a large corporate organisation, you can't introduce a medical management system. You're part of a bigger idea. Otherwise, you aren't going to be there long. Second takeaway is listen to the quietest voice in the room. I think it's been said before, this is about empathetic management, it's about humility, it's about sitting in a meeting and working out who hasn't said anything, because they may have the most important thing to say in regard to the issues you may be addressing. I've also had the pleasure of meeting some fantastically humble leaders. One who was a shuttle pilot, who now works a NASA shuttle pilot. Somebody else mentioned NASA earlier on. He was on the Challenger mission before the one that blew up, and he was involved in the investigation and talked to the groupthink about those tiles and bits of foam that had come off and whether it was important or not and how it was disregarded. He now works for BP. And he came to join us. The third one is go, see and assess. It's great having data and triangulating, and I'll talk a little bit about that, but there's no substitute for being the mystery shopper, going to the front line and finding out what's really going on. Only then, I think, can you develop the organisation's personalised medicine that is suitable for the patient without side effects and actually is also evidence-based. So a very nice segue, thank you very much, Michael, looking to values. And again, talking about organisational leadership with health at its heart, which is what I think our challenge is. These are the BP values: safety, respect, excellence, courage, one team. I think Michael's asked us for all of these in health settings. Courage, we talked about, excellence and quality, working as one organisation. And I've just really indicated, if you can see it, what's expected of me if I'm delivering safety? So safety is critically important to an organisation like BP, as I'm sure you're aware. But when you're delivering safety, you cannot do that unless you are demonstrating your personal responsibility for the safety and well-being of everyone around me. And that's the question that gets asked of leaders. How are you doing that? How can you be held to account on the safety and well-being of everyone around me? I also, again, this is about culture and values. The other thing I'm reminded of is that two things really. The first one is about the words. You talked about it's got to be more than words. It's got to be the way we do things around here. But I would ask you, it's actually the way we do things around here when nobody else is looking. That's about when you've changed the culture or changed the values. When nobody else is looking, are you actually doing what's written on the tin? So I'm sure I don't need to describe where these come from, but again, it's just to say, I think the same resonances in healthcare settings are to be found in large organisations. Respect, dignity, compassionate care at the core of how staff are treated. I've just picked out staff. It impacts patient safety and outcomes all improved when staff are valued, empowered and supported. I think these things do bear repetition, and hopefully they stick throughout the morning. So again, coming back to management systems, there's something about leadership which is about the vision, and the inspiration around the vision. But the other part is actually about systematic management, doing things the same way again and again. So I've just put on here an extract from BP's management system. In the circle, you can see what's called an OMS, Operating Management System, and that describes the range of activities from preventive maintenance, leadership, audit, engineering standards, risk management, right across the portfolio of activities in what's a very diverse company with everything from wind farms and refineries through retail stations. But when I arrived at BP in 2006, I was looking for the health thread in there, and I have to say I did find it quite difficult to find. But I did see this people, plant, process, performance as an integral part of the engineering management system, of the operating management system. So I asked 100 and odd executive managers what they thought health was. I got everything from, when my relatives are, who do I speak to, fitness to go and work offshore, a whole range of activities, where I get my immunisation, what happens if I'm sick and have to come back to work. And really no sort of congruent description. So I said, well, it's really very simple. Just put the word healthy in front of all these things. If you're thinking about healthy people, it's the people who work here, it's the contractors that you employ, it's the people who buy your products, the lubricants and the fuel, and it's the people who are touched by your operations, wherever you are in the world. That's about healthy people. That's everyone around me when we look at, are you living the values? Are you considering the people aspect? The plant is the place where you go to work, where you should arrive at work and leave work with, at the very least, your health in as good shape as when you arrived. And I would ascertain that you actually should get your health enhanced by being at work. You should come away feeling optimistic, energized by your work, not trodden down by it. Actually, it does remind me of a small anecdote, which was when I was working for a different company who went through a merger, and I'll touch on that in a moment, and they talked about the values of being fair, fast, flexible and forgiving. And it didn't really feel like that. We had people who were fat, flat, frustrated and fed up with being there. So, and I was asked, where's the data? I said, look, the data is you walk into the canteen or the restaurant in any location and you close your eyes. If you hear laughter, it's a great place to work. If you hear nothing, apart from unless it's the library, it's a dreadful place to work. You can go and actually, again, triangulate, look to confirm that, but go out and walk about. Sounds very obvious. So that comes down to what you can do, and it's really about trying to align your medical or your health strategy with what's the organisation trying to achieve, what's the management philosophy, what are they trying to achieve, and how can you help your executive deliver what he or she wants to deliver. Because actually you'll win a lot of friends by doing that, and you'll get their support. And I constantly am looking for Trojan horses to package my effort so that somebody else takes it up the hill. So employers in all settings want commitment, productivity, quality or patient safety, or profit or less cost. Employees want flexibility, respect, fulfillment and money. And our challenge is to look where are the sweet spots between these areas. You could say the same thing about governments and employers, or governments and people in employment. I was asked to define health and business once, and people say, oh, businesses are there to make money, or organisations are there to make money. And then I read Peter Drucker, an organisation doesn't survive unless you have a client or a customer, somebody that you're there to please, or somebody who wants your product. And then Lord John Brown, who was chief executive of BP in the past, made this comment: businesses that focus purely on money, don't invest in the future, in the employees' ideas, marketing products, they won't be around very long. They need to be part of society and exist to meet society's needs. And again, that's about people, healthy people, the people who are touched by the operations, the people who buy the products, as far as I'm concerned. Anyone want to hazard a guess? It's Christopher Columbus. And I put him up here because within any organisation, somebody's measured it before. There are a series of stars to guide you. Now, Christopher Columbus obviously was trying to get to the Americas, and he had some fairly basic equipment, and then he found 3 stars to guide him. And do you know what? He nearly got there. He got to the Indies, and it was kind of close enough. And all he really knew was, these are my guiding stars, and what triangle of sea am I in right now? If I know those things, then I can go in that direction. I think that's the challenge for us. It's not waiting till everything's proven beyond absolute doubt. It's saying, where are my guiding stars? Is it the staff survey? Is it the absence data? Is it the infection rates? Is it the patient satisfaction scores? Somebody is collecting all of this and many more things, and they're all inextricably linked as predictors. So when we look at staff surveys, I'm going to now take you back to 2000 when I was working in a pharmaceutical company that had just gone through a merger. And I wanted to use the employee survey as a Trojan horse. I don't know how many of you have tried to get questions into somebody else's employee survey. It is nigh on impossible. You might get 1 in 100. But actually you don't need to. It's finding the questions that are already being asked by somebody else, and then the killer question that you're looking for. So I put this slide up because actually what you're looking for in terms of people who have a sense of personal well-being is that balance between the demands upon you, either qualitative or quantitative, the support that you feel that you need to deliver those demands, and that support may come from your relatives, from your peers, from your boss, from your organisation, from yourself, and the degree to which you feel in control of managing those demands, when you do it, how you do it, control over what you're doing. And that's really taking some of the work from Tyrrell and Karasek in Karolinska in the 80s and 90s, and then also some of the work on the stress standards from the HSC, role, relationships and change. And then it's go away and identify hotspots. So what I've got here, it's quite difficult to read, but this is the embedding of an employee within an employee survey that we're using. And there are 2 questions on demands, 2 on control, and 2 on support, and an overall sense that I believe the company cares about my health and well-being. Now, I've clearly scrambled the data so nobody knows who it is, where they are. But what I took very empirically was, and I did this back in 2000 in the pharma company and then have done it since, is if you get 3 times 2 standard deviations from the mean, in other words, if there's something wrong in demand, something wrong in support, something wrong in control, it's worth a good look to see what's going on. And this is a very simple Excel spreadsheet, and I can look at every place, every grade, in the company to see where we have hotspots. And it's based on the work we did, as I say, in AstraZeneca, which is where I was working before BP, which shows, using structure equation modelling and statistical techniques, that all of these aspects are inextricably linked to each other. Where people have a sense of positive well-being, their intention to leave is reduced, their perceptions of safety are improved, the climate of innovation and the general sense of the climate is improved, and their alignment with the leadership and HR principles of the organisations and its ethical principles is improved. I might even take a little bit of issue, Michael, with the order in which you have those priority areas. And I actually wonder whether employee engagement comes above carer and patient. In as much as if we get that right, that follows. They're both important, don't get me wrong, but actually the more you've got an engaged workforce, the more that carer and patient engagement follows. And this is just taken from Francis at King's Fund, another. So I've not been there, but at least I've stolen with pride from them. And this is showing the opposite. So what's the opposite of engagement? Habituation, somebody else's problem, keep your head down, fear, isolation and disengagement. If that's the culture, it kind of doesn't matter what you do. The other sort of truism is that culture eats strategy for breakfast. So unless you have addressed culture, your strategy is bound to fail. So this was after a merger. We matched the 100 questions with the things that make people feel better or less good and found out for about 70,000, workload was an issue, reward and recognition was an issue, job insecurity and redundancy was an issue, and lack of control over work when you're actually doing two things. You're doing your regular job and you're merging. Quite important, I think, when trusts and NHS organisations merge or separate, to understand what are the big issues people are negative about. But do be careful. This is just to show some cultural things across different groups. So we had questions around fear of redundancy, and what you can see here is if you look at USA, 48% of people were worried about losing their job, but the control group, which is the lighter box rather than the darker box, was about the same. So people in the USA have short tenure, they're equally worried about their job. In Sweden, people in the company in the dark box were far more comfortable about not losing their job than the average Swede. I have to say, trying to let a Swedish employee go is incredibly difficult. The employment arrangements are so tight. But in Japan, it was the reverse. And we looked at Japan, and there were some very interesting management behaviours going on in that factory. There were issues about product quality and a whole range of things related to each other that were predicted purely on the basis of the employee survey. So I've just put some further thoughts, because when I talk about the quietest voice in the room, I do wonder, I'm actually in occupational medicine, not occupational therapy, or other things that people might wonder. But is occupational medicine lost in action? Because actually, if you've got a corrosive culture, where might people go when they don't feel they have someone they can trust to complain to? One would hope they go to occupational health. When they are absent and sick and come back to work with a mental health and stress problem that they don't particularly want to discuss with their manager, who might be at the root of the problem, where do they go? And actually, I think we should be calling for quality assured occupational health services in all trusts. And they shouldn't be places where, as a management tool to cut absence, but places where people with mental health or concerns can self-refer for prompt, sensitively handled confidential intervention and rehabilitation. They should be a key component for delivering organisational productivity and improvement and performance, a facilitator of staff health and wellbeing and enhanced personal health, and a prerequisite in a comprehensive patient safety and patient-centred strategy. So finally, just end with a quote from Robert Rosen, hard to read, I'm sorry on the background here, but again, you've seen the evidence from Michael, Goddard, Spurgeon. Read the Borman Review. Read the Borman Review, just another piece of the jigsaw. But I truly believe healthy people do make healthy companies or healthy organisations. More often, more likely, and over a longer period of time, they will make healthy profits and healthy return on investment. You can replace those words with, they actually will help organisations to be more successful for longer and achieve their aims. Thank you.
Thank you very much. Some very strong emerging themes here. You know, the importance of vision and action, the importance of leadership with compassion and humanity and humility. I think last year's word was love. We haven't quite got it in. I got it in with the romantic, but it is something about that. And then the thing that has always seemed to me to be the greatest privilege of leaders, the ability to unleash the potential of everyone that you work with. For medical leaders, yeah, it's great to unleash the potential of people in the room, and even more important, the people not in the room in the profession. But you also have a leadership role as part of organisations to reach and unleash the potential of everybody working in the system. And if we could do that, if everybody was unable to do the best they could, wouldn't that be fantastic? But I leave you with one other word that hasn't been there yet, but it's also the characteristic of great leaders and effective organisations, and it's the word of celebration. It's really hard at the type of reorganisation or the negative criticism is to start believing only the down story. Great leaders actually create not complacency about what goes wrong. They use every complaint to celebrate the opportunity to improve, but actually they celebrate what is good. And one of the things that's really important for the NHS and for the systems we work in over the next couple of years is to find the space for celebration at times of trouble. That's, again, one of those ubiquitous messages across all industry. So now you have time to celebrate lunch. Can you be back in your workshops for 2 o'clock? Some of you are going to lunchtime sessions. And then you're back here for 5 o'clock for the AGM, and then the drinks reception will follow on from that. So I look forward to seeing you later. Thank you very much.